Public health, because of the breadth of the resources that become available once you get into the public health arena, public health has a lot to offer for, in particular, our rural areas, because you have resources, for instance, to identify a particular health issue. Then you have resources that might be able to identify the source of that health issue. Then you can bring other resources together that can provide solutions, and then even further, as you implement the solutions, can provide the logistics. So the public health arena is a potential, powerful tool, powerful platform for addressing any health issue, but I'm thinking particularly the issues in rural areas where logistics and all of these other things become that much more complicated. I think what we owe everybody, every citizen of every country, is the highest possible quality of living. And that includes people in rural areas. Now, whether we realize it or not, we've moved away from a lot of small farms and farming communities in our rural areas, but nonetheless, our food still comes from our rural areas. So if we don't pay attention to the health of those rural communities, and I don't mean just clinical health, I mean all of these other social determinants of health and so on. If we don't pay attention to these health issues in this rural population, we run the risk of our food system breaking down. Issues in a rural area are called invisible. And by that we mean that you can drive through a rural area and not really see the particular problems that our rural population has to deal with. For instance, it's easy to say that oral health is a particular public health issue and that we might ask our municipalities and other areas to better fluorinate their water. Well, people in our rural areas don't have access to fluorinated water. They drink well water. And if they need to access resources like even dental care, for a person whose nearest neighbor might be a half-mile away and there's no public transportation anywhere near them, that's not possible. Globally, in terms of rural public health, other countries actually do a better job than we do because other countries have developed a better system of integrating resources. So in the United States, we've done too much siloing of resources, where one resource might be available to address mental health issues, another silo might be available to address other issues, but there's nothing to bring all of these pieces together. In other countries, they do a far better job. They actually, in many places in Africa in particular, do a much better job of using technology to address some public health issues. The biggest issue that needs to be resolved, and this is where the public health community can play a role, is in public policy. Because right now, again, rural issues, rural health is invisible. It's just too easy to spend all of our money in our urban and suburban areas and forget about the rural areas because it's difficult to access. It's dispersed. So I think we need a bigger push in terms of public policy and public awareness of the particular issues that the rural population needs to deal with, and then figure out unique solutions to those particular issues. They may not be the same kind of solutions that have been used in our more urban and suburban areas.